Thank you, Doc.
Sit. Miss Linda, you want to sit there?
Medication compliance is a big issue with older adults, mostly because they may not have a caregiver and they forget to take the medication. But that's not the case with Mr. Hutch.
He's in his 70s. He has mild dementia. He's also blind, both from diabetic eye disease and a lye accident to his eye several years ago. He has a young wife, I think a generation younger than he is, and he has some minor medical problems. He has diabetes and hypertension that are fairly easy to control. Now, your wife tells me that you don't like these pills I gave you too much.
No, they kind of mess with me, Doctor.
Tell me about that.
You know, I don't know. It's just I see bad things. And
You see bad things?
yeah, and I don't see nothing good. One time, it was an elephant had got in the house, and I'm doing all this in.
Do you understand what he's talking about?
At night he do.
At night.
He hallucinates some?
Yes.
Yeah.
Do you realize the elephant is not there? Does it seem real to you?
Well, no, it didn't. After I had, did Tarzan thing. You remember Tarzan? Last Tarzan.
Get him to do his
But
judo.
he takes the
up.
metformin with no trouble.
No
So
problem.
that one he'll
He will
take, but we can't get him to take his blood pressure medicine or the
We
aspirin.
don't, no, he won't, and he only want. and
The
he's
metformin.
Right, he
He's
should
supposed to
take
take it twice a day, but what you can get him to take is one metformin.
Yeah, he'll take
No,
it.
I do it on my own.
Yeah, he won't, I
That's
used to
right.
give it to him,
Okay.
but now he do it himself.
But he's not taking the aspirin, he's not taking the lisinopril, and of course he's not
Aspirin. What aspirin will you take, baby?
The bear aspirin.
the baby aspirin. The biggest problem is it's not a problem, but he's not very compliant with his medicines and he's very religious.
Remember, I am a pastor. But now let me tell you something.
Yes, sir.
I know we have a Jesus, right?
Right.
All right. So, Doc, that's where I keep my trust and faith in Jesus, and that's when things don't happen to me.
How about your doctor works along with Jesus?
that? All right. That's
How about
right.
the
He went through it.
medicines and your faith work together?
Well, see, I tell you, that's something that I never have been too good to take. Cause I never smoked a day in my life. I never drunk a drop of liquor a day in my life. Never have in my life. That's a God have no truth. And see, I always tell my mama, if you take care of your, what I do?
You can start preaching.
That's what I'm saying. That's what I'm just going to do. But see, all we have to do is take care of ourselves.
He will only take one medication, and that somehow that connects to his religion, that he'll only take one pill.
Jesus went through doctors,
I agree with that.
and he also went through me.
So I've had to prioritize of his medications, what do I think is most crucial for him, and bargain with him. Let me ask you this. I'm going to give you a shot today. You have a vitamin B12 deficiency. I'm going to give him a shot. That'll last a month or two.
Right.
Good. You're taking your diabetes pill.
Yeah.
Yes. Could I convince you to take one blood pressure pill, or maybe not?
No, doctor, I don't think I'm gonna ride them horses.
You're not going to ride that horse.
No, I'm gonna go as my father tells me, which is out in heaven.
And today I didn't confront his religion, but I suggested that why couldn't I work within his religion? That his God and religion and doctors can work together. We can have the same goal, and perhaps that we can together provide a better outcome. I enjoy taking care of them, though. He's lively, he's humorous. He's not going to do most of what I suggest to him, and that's okay. Let me tell you, I think the most important medicine he's on is his diabetic pill, the metformin. So at least he's chosen the drug that I think is crucial for him. He would take both of those, but he has to make his own decisions.
And how long had he been a patient with you?
I think I've known him for about 2 years. It's whatever you think is right for you.
Okay, well, see,
We tried dementia medications, but he just would not take them. He just thought they were silly. So it's not absolutely essential that he's going to have a stroke tomorrow or something if he doesn't take these medicines. I just want to keep you as healthy as you can be, so I decided to concentrate more on his medical issues. Older people are often fairly compliant, but in his case, his dementia, and I'm not saying a delusion, it's not a delusion, he's not delusional, he has a religious belief that pills are unnecessary and doctors really you don't need a doctor, you can heal through faith. I'm not going to directly challenge that. I think that's inappropriate, but maybe I can work with that. This man's in front of me with his concerns, his background. I have to take him as he is. How can I help him? So today, for example, he said he was only going to take one shot, but his wife convinced him to take two.
okay, well, see, I would like to go by the doctor rule also,
Well, why don't we do
too.
this then? He got the B12 shot, and his wife said give him the pneumonia vaccine. So we used the caregiver there to help us get that shot in him. You decide if that'll work for you. It may work, it may not. And I think we'll just see how he does.
When there are compliance issue with your patients, what kinds of strategies do you use to help them to be more compliant?
Well, we need several people helping with that. So can I get your daughter or your wife to assist you with that? We can get a box that medications are put in. Some patients are still living by themselves. We can see if a family member can drop by once a day or once every other day and see if those little boxes are empty. We can try to simplify the drug regimen, try to get everything down to 1 dose per day of medicines. We can also try to reduce the number of medications where possible. Or we now have combination pills where we can treat more than one thing with, put 2 drugs in 1 pill. So those are all some strategies. Also ask, are all these drugs truly necessary? What is the goal of care for this person? Especially as they get frailer. As their dementia worsens, as their organ failure worsens, do they really need tight control of diabetes? Is prevention of stroke and heart attack in this particular patient still a goal? Should we put them on a powerful blood thinner? What is the risk-benefit ratio? And those things change over time. And I find that many patients are just taking too much medication. And we can simplify their regimen and they'll perk up, their function will improve, and we go from there. There's not a lot of randomized trials in 85-year-old frail people on 8 drugs. In fact, there are none. Any breathing trouble? You're eating good?
Oh yes, man, that lady over there, ooh,
She can
child,
cook.
said nothing, man. You know what you should do? You should eat 2 of that lady biscuit. You just melt in your mouth.
You can bring me a plate of them next
Oh
time.
no.
No nausea or stomach problems. Sometimes metformin causes stomach trouble. None of that.
Yeah, so far, no problem.
What level of severity do you think
He's still mild. And the way I would gauge dementia is based on their function. So a mildly demented person is either independent in their activities of daily living or needs minimal assistance. A severely demented person is dependent on all other ADLs or most of them, and moderate's in the middle. A mildly demented person can live by themselves. A family member can check in on them. Now, he does have blindness, which complicates things because he needs some help with that. A moderately demented person can be left alone briefly. You could go out for an hour. A severely demented person needs constant attention. So it helps me focus where they are and then focus resources for that person. Is their living situation appropriate? So where he is, with his wife, she doesn't have to be there all the time. It's perfectly safe. Just take a listen to that old heart there. See how it's doing.
Okay.
Would you treat him differently if his dementia is more moderate than mild?
Well, the major thing is you can decide whether to use medications. We've got medications to use which are very minimally effective. I think we can offer that. But there's a lot else to do for people who are demented. First of all, we need to make sure that we've got their comorbidities well managed. Are they properly diagnosed? Have we taken them off of medications that are anticholinergic, that are sedating, that increase the risk of falls? Have we looked at nutrition? Are we giving them meaningful activity? What's an appropriate activity level for a person, for example, as they become demented? We can give suggestions for that. There's often caregiver stress. Taking care of demented people is usually not too stressful on the demented person. But the caregiver is very stressed out because the person just gets sicker and sicker and sicker no matter how much effort they put into it. So finding a way to get that person some help through support groups or services is useful. And then, of course, toward the end of dementia, the person's going to need either round-the-clock care in a home or probably nursing home care. It's just overwhelming for a family to do that. So that's part of our effort there, is to look at the whole picture and mobilize resources when the person needs it. Your wife is right. It protects your kidneys,
Yeah.
it protects your heart, and it protects your brain from having a stroke.
He'll take both of them. Yeah.
He will.
Yeah.
I can go ahead and get the nurse to do that?
Yeah.
Missing a dose of metformin is okay, but taking lisinopril like 2 days and skipping 2 days and going out, that's risky. So he either needs to take it, and if you can't get him to take it regular, then don't do it.
What is called for stroke or something?
Yeah, I don't want you to have one.
No, and I'm not.
Good.
I'm not gonna have a stroke.
You're going to will it away?
Well, as long as my health don't fall.
There you go.
That's what I put. in
So
my life.
how about we treat your blood pressure and we rely on the Lord all together? My idea is to keep the person in the least restrictive environment, even if there's some risk to it. For most people, they'll accept that risk. Don't prematurely place people in nursing homes. If we need that level of care, that's fine. But there's often other options.
All right.
It's a pleasure to see you.
Same here. May God bless you.
Yes, God bless you, and thank you for coming by today.
Thank you, kind.
You had any other questions about him?
No, that's about
Nurse will be in just a minute.
Okay.
Yes, Doc. If I ain't sick, I'm still gonna come by and see you.